Hello, everyone, and welcome. My name is Megan Guevara. I'm with JSI Research and Training. I'm going to be your moderator for today. We do already have a question in the chat box about getting access to the slides. This is just one slide. We won't have many today, but we are happy to share them. And thank you all so much for joining us for this conversation about 85 to stay alive and how to address inhumane prison temperatures in a warming climate. This is an issue of life or death for many people who are incarcerated in the United States, and not one that gets a lot of attention. We all know that climate change is impacting all of us in different ways, from extreme temperatures to extreme weather events, wildfires, drought, and people who are incarcerated are experiencing some of the worst of those effects, along with many other folks coming from under-resourced communities, people with limited mobility, and people who are facing chronic health issues. So in our webinar today, we're going to hear from people who have direct experience with extreme heat in incarceration facilities and their family members. We're going to hear from researchers who are focusing on this issue. And we're also going to hear from advocates who are proposing common sense solutions that could very easily save lives related to extreme heat and incarceration. We have a packed agenda today. I don't know if we're going to be able to take questions from the audience, but please feel free to have conversation in the chat box throughout the event today, and we will be following up with everyone. The recording will be available later on the Texas Prisons Community Advocates YouTube station, so we will send that link out to you once that's posted. And we would appreciate you sharing it far and wide with anyone in your networks. And to kick us off today, I would like to invite Dr. Amit Dominic, who is the Executive Director of Texas Prisons Community Advocates and the founder of the 85 to Stay Alive campaign, and Dr. David Siplett, who is an Associate Professor of Environmental Studies at the University of Colorado Boulder, and my former professor who got me involved in this issue, to join us to kick us off today. All right. And welcome, Amit and Dave. And Amit, I want to start by asking you that your organization is focused on addressing extreme heat in prisons. And why is this an issue that demands all of our attention?
Well, this is an issue that for me started back in 2015 when I found out the majority of the Texas prisons do not have air conditioning. And then from the stories of impacted family members, formerly incarcerated individuals and currently incarcerated individuals, I began to find out exactly how extensive this problem is and how detrimental it is to not only the incarcerated individuals, but also their impacted family members and therefore the community at large. And then also what I began to learn about is climate change and seeing the impacts of climate change having an increase in temperatures within those prisons, and unfortunately more and more people expiring due to those extreme temperatures.
Thank you, Amit, and looking forward to hearing more from you throughout the conversation today. And Dave, Amit and her colleagues have seen this firsthand through lived experience, but there's also a lot of data that backs up the impact that this issue is having, and would love to hear from you some more about what research is telling us and what your ongoing research looks like.
There is a wonderful group of scholars, many of which are working with community members and community organizations that are trying to pull together some of this information and research related to climate change broadly, and specifically also to extreme heat and also extreme temperatures, including cold. Just to give a bit of background, so we see with climate change increased frequency and also the intensity, the strength of types of events such as flooding, disease, wildfires, and extreme temperatures. And these are specifically hitting carceral systems, and they're exacerbating, making worse the inequalities and the types of harms that are already being experienced by incarcerated people. So all these different types of climate events have impacts, and then there's compounding impacts when we see, for example, fires and smoke and kind of health impacts related to that, in conjunction when we also have high temperatures, as an example, but others as well. And as we know, Black, Brown, and Indigenous peoples and other marginalized groups are disproportionately targeted by carceral systems. and therefore are also facing the brunt of these impacts. And they're also more broadly in society also facing these impacts more strongly than other groups. And then we look to specifically look at incarceration heat and health and how those come together. A lot of this research has been done by Julie Scarha, where she found positive associations with increasing temperatures and total mortality rates, including heart disease-related mortality rates and suicide during the summer months. Particularly also, this is exacerbated during heat domes when we see multiple days in a row of extreme heat. Inside Texas prisons in particular, they found that approximately 13% of total mortality in prisons between 2001 and 2019, 271 deaths were likely attributable to extreme heat exposure. And things like poverty, age, chronic health conditions, the types of medicines you take, increase vulnerability. And then we also know that extreme temperatures also increase rates of suicide and also violent interactions. And then just turning a little bit to the Climate and Incarceration Research Collective and working with Dr. Dominic's organization, Texas Prison Community Advocates, and also Megan Guevara, our host here, has been working on these as well. We have 3 policy briefings that will be coming out in the next few weeks, intersecting vulnerabilities, looking at climate change in the criminal legal system, just transitions in the incarcerated workforce, and then incarceration, heat, and health in a warming climate, which I'll talk a little bit about. And so the last study that I just talked about in conjunction with Texas Prison Community Advocates, who collected the data from 2021 to 2023. This is looking at 87 incarcerated individuals that filled out surveys and 131 family members of incarcerated individuals. And 100% of family members reported concerns with heat exposure by their loved ones. And 96% of them said their loved ones were in prisons that lacked air conditioning. And incarcerated individuals and family members that were surveyed pointed to several factors that were influencing health in really negative ways. The most important was access to quality both mental and physical health care. There was lots of answers on that. Access to clean and healthy drinking water was a big one. Having abilities to have respite from the heat, and then access to cool showers necessary to protect health in extreme temperature environments. And my last slide, I just want to talk about some of the research that we're just starting working on now with some of the folks you'll hear from Michael and Bob with Remerge, who are also working on this project. And this is an interdisciplinary study looking at the convergence of extreme heat incarceration and health in Colorado. And we will be we're just starting, we'll be doing interviews and focus groups with formerly incarcerated individuals, and we'll be doing what's called forensic vulnerability analysis, which will be building kind of 3D models of prisons based on the qualitative data that we collect to really try to understand what are the factors that are influencing vulnerability and harm related to extreme temperatures. And so this will include kind of the physical infrastructural environment, looking at the institutional and social practices, and also the epidemiological factors. And that work is also co-led by Kate Lemasters, who hopefully I think is on this call as well.
Thank you so much, David. I just want to underscore a couple of the points that you made there, especially the study that showed during a period of a few years, 271 deaths that were attributable to extreme heat in Texas prisons. This is literally life or death for a lot of people, in addition to all the folks that are dealing with exacerbated health issues and increased safety risks as a result of folks trying to function in unbearable heat and temperatures. And the fact that you're doing this research in Colorado, which I think most of us don't think of as necessarily a very hot place, but as climate change is getting worse, as everyone here is experiencing higher temperatures, that this is not just an issue that southern states are facing. It's not just an issue certain states are facing. It's an issue that that people are facing all over the country as a result. And we're looking forward to seeing the results of that research when it's available. And also, if folks are interested in any of these studies, please feel free to drop a note in the chat box, and we're happy to follow up to be able to share some more of this research. And I know that Meet shared the 85 to Stay Alive website link, which also has a lot of the stats and a lot of the background information, including information on the studies and the briefs that Dave mentioned. And we'll be posting those on both the Circle website and the 85 to Stay Alive website when they're available. All right. Thank you so much, Dave. Thank you, Amit, again, for providing some framing for those issues. And now I would love for us to be able to hear from folks who have lived this experience, and would like to invite Bob Eisman from Remerge, Colorado, and Michael Clifton, who's a program manager at Remerge, Colorado, to join us, along with Janet Delk, who's a representative from Texas Prison Community Advocates. Thank you all so much for your time today. Lisa Bell from Truth Be Told may be joining us as well. She was having some technical issues, but she may pop in. And so all of you have experienced extreme heat or had family members who experienced extreme heat while incarcerated, and would love to first just ask, and Janet, maybe I can ask you to speak first about an experience that you can share with us. What has been the impact of extreme heat on your family member?
Yes, thank you. Thank you for allowing me to speak. And it is a loved one that I have who's incarcerated currently. I'll share an experience just recently, which was my loved one is in here outside of Houston. So Hurricane Beryl affected us in July, which is, of course, was one of the hottest months. His unit where he was at lost power for 8 days. So currently, the way they mitigate heat is with, of course, with cold water, with fans. That wasn't a possibility during those 8 days. He's also housed in the second floor, so heat rises. So when I was able to hear from him, and again, we weren't able to hear from him because the power was out, he was telling me about the men sleeping on the floors, just on the concrete, just to try to have some type of respite, that there weren't water, that when water did come on, it was they had boil water notices. But how do you boil water if you're an incarcerated individual and you can't do that? My loved one is also a veteran, and so he has experienced heat, unbelievable heat, when he served in the Persian Gulf. And what he tells me that he experiences there is just almost torturous. So what it does to him, of course, he has health issues. The men don't sleep at night when it's that hot. Of course, it exacerbates all of their medical issues. But I just wanted to give just a small talk about what it does to their family members, because as our family members, we know there's nothing we can do for them. I know that there was a survey that was just put up about the family members, and what we advocate for our loved ones is not just the heat, but the water, the medical issues. And there were 2 things that struck me was when Dr. Dominic was talking about why she got involved in this, was because she noticed how many people were expiring because of these issues. And you quoted a statistic of 271 deaths. So when I speak with other family members, with other loved ones, the impact is that we wait every day because our loved ones were sentenced to prison. They weren't sentenced to death, but we wait every day for the call that says that they're never coming home.
Thank you for sharing that, Janet, and so many important points in there about what risks we are putting people through as a result of incarceration, that is partly daily temperatures, but also extreme weather events and other issues, and the difference between being able to get a drink of cold water or take a cold shower or step into an air-conditioned room when you want to regulate your body, when you want to keep yourself healthy, versus not having any control over what your circumstances are, and then being the family members sitting at home and also not feeling any control over someone's health. Appreciate you sharing that experience. And would love to turn to Michael if there's anything that you would like to share.
Yes, hi, I'm glad to be here with everybody. So I served almost 25 years in the Colorado Department of Correction. And I can speak directly to my experience, specifically when I was spent 5 years in solitary confinement. And being locked down 23-1, sometimes it's that 23-1, sometimes you don't even get that 1 hour out. But being confined in that cell without the ability to have, fresh air, without the ability to be able to move around, at least in an open space, was really, debilitating, really, on my mental health, on my just my ability to stay productive and stay focused. And it caused a lot of stress. It caused a lot of, problems and tension between me and staff, as well as, just the communication with my family and things like that, and their concern for, how I was doing already in a stressful situation and stressful environment. So, I had to endure that for almost 5 years, and it was really tough. When you're in solitary confinement like that, that 1 hour out, you did have the ability to go to another room that was supposed to be like the recreation room. That did have a small, like, vented window, but even that, didn't really help with the heat. Didn't really help. So, just I think that had a really long-term effect on my mental health, but also just my physical health as well. And thankfully, I didn't have like a lot of underlying health issues and things that I was dealing with. I know a lot of other people are dealing with things like asthma, diabetes that heat can contribute to, and so for me, it's just really important to be able to speak about that experience, what it was like, and try to figure out, what are the steps that we can take to make those conditions better. Because as it was mentioned before, the sentence is the punishment, and one shouldn't have to endure those type of conditions.
Yeah, thank you for that, Michael. And we will definitely be digging more both into the physical and mental health issues that you mentioned, as well as, what can we be doing about this? I'd love to invite Bob to join the conversation.
Yeah, sure. I did a little over 15 years in Colorado prisons, and like you're saying, Megan, Colorado's not really known. People don't think about the heat and stuff, but out on the plains, it gets really hot. And then we also have prisons in the mountains. It gets pretty cold. It's definitely a wide range of things. But a few things to say is, for starters, that next to last slide of Dave's that had the 4 things, the suggestions or whatever, like with the respite from heat and clean water, and I don't remember any of those 4 things ever happening. Those 4 things would have been great in the summer if you're on the plains in the 100 and something degree weather and stuff like that. The only cold shower I can ever remember taking is in the winter when the boilers go down and they're broken. So, and the freezing cold. So I guess kind of trying to share an experience. I think that the biggest experience, the most directly that it impacted me, is I was celled up. I was housed with an elderly gentleman who was he had to be in his mid 80s, and the heat was definitely getting to him. And we were in a prison that did not have, you couldn't open your windows, couldn't and then once any ventilation goes down, there was no air conditioning, no air and stuff like that. And you could tell that all of his health problems just built and built and built. And then, it's one of those things. I mean, you can't say that the heat was the cause of his demise, but it definitely didn't help. I guess I could put it that way. And so he ended up having a heart attack, and we you're never told when people, Michael could probably talk about that a little bit too. If something happens medically, they're shipped off and they don't tell people what happens to them. So, but you kind of have to assume the worst, that kind of thing. But the biggest issue personally, other than that experience, was when it is hot and like extreme hot, the mental health aspect of it is just, that's the biggest aspect of it for me. I went in when I was in my 30s, and the physical toll wasn't as bad, but man, that mental toll with the heat is excruciating. There's no getting past it. And then to live through that with Michael and I were both in for COVID. So when you dealing with that on top of not being able to get out of that cell or go anywhere, just exasperated it. So
Yeah.
that's about all I have to say on that question.
No, I appreciated that. Thank you for mentioning the 80-year-old gentleman, which I think is an important reminder that there's many people who are aging in prison and who are dealing with all of the health issues that come with aging, and having to do so while they're incarcerated, and heat is only making that worse. And as you all mentioned, this is a mental health toll, and it's a mental health toll that was not part of the sentence that was imposed on anyone. It's a mental health toll that we put on everybody that's in prison in a variety of ways. And that combined with the physical toll is taking years off people's lives. And I would like to get into that question of health a little bit more. And as you just said, Bob, like we have estimates of where we see excessive deaths during times of extreme heat, but often those deaths are there's heart attacks, there's other reasons that are given that aren't necessarily attributable to extreme heat. So the burden that heat is putting on us is probably a lot greater than we understand from the current research that's available. But Janet, I'd love to go back to you to hear a little bit more about what you have seen in terms of the physical health impacts of extreme heat.
So my loved one is of the aging generation. So he's going into his mid-50s. He has chronic high blood pressure. So of course, he's been to medical several times. He's passed out twice during the summer because of the heat. He's been taken to transferred to a medical facility for testing. But one of the things that the heat exacerbates a lot is the fact I've told you that he has high blood pressure. Well, one of the things they want you to do is to keep hydrated. How are you going to keep hydrated in this heat? They want you to take electrolytes. What they don't think of is that somebody with high blood pressure is not supposed to take electrolytes. The sodium's so high, the sodium content's too high, the potassium's too high. And so what that does is just raises their blood pressure higher. So they're resulted to just taking regular water, which sometimes does not do the trick. There are, I've talked to you about how they don't sleep. So that exacerbates medical issues. But something that a lot of people don't talk about is the heat rashes that come. The heat rashes that turn into infections, and then that turn into much more dangerous medical issues. And one other issue, if we're talking about medical, is that here in our prison systems, if you get transferred to a medical facility, all of your visits are canceled. Your upcoming visits are canceled, so you miss the time out with your family members. So our incarcerated loved ones choose not to go because, as we're talking about their mental health, what does that do to their mental health that now they can't see their family members for 2 to 3 months, because that's how far advanced these visits are taken. So again, my husband was we've had some scary thoughts because of those issues and what he's going through now. And again, how do we keep them hydrated if you can't keep, if they don't have access to those electrolytes?
Yeah, so the basic things that are related to day-to-day care, as well as not being able to advocate for family members in the way that so many of us want to when somebody is struggling with a health issue and you want to be able to be there for them and support them, and that you just don't have the ability to do. Thank you for sharing that, Janet. And Bob, would also like you, if there's anything else that you would like to share on this front, or anything from the perspective of your work at Emerge.
Yeah, something that Janet brought up there that maybe not everybody on this call knows about is the whole going to medical in the heat. If you go to the medical in the middle of summer, I don't know how it is in Texas. In Colorado, though, Medline is outside. Like, you're waiting outside in the sun with no shade, no you're not the drinking fountains all the way at the front of the line, and that line can take a lot of these guys. I was lucky enough not to have to deal with it, but like you guys that are waiting for insulin, or guys that are needing their meds, are waiting out in that sun and having to sit in that sun for sometimes hours at a time, just making the problem even worse. I just wanted to throw that one in there.
Thanks, Bob. And something else that Michael alluded to a bit that I would like to get into a little bit more is the safety factor. And the heat is an issue both for folks who are incarcerated as well as people working in the facilities. Everybody who's there is exposed to the heat, and it takes a toll on folks' mental health. It is a stress factor, and it contributes to safety issues in prisons as well. And Michael would appreciate if you could speak more about what those safety issues look like.
Yes, definitely. There's no doubt, if you've done time, you know that in the summer, while the heat is up, that's when you're gonna have your more issues with other incarcerated folks, as well as with staff. The aggression, people's just kind of, I guess, snapping, because they're frustrated, they're not probably not handling their emotions, or handling incidents very well, and they just respond by with most of the time with violence, and that includes the conflicts that incarcerated folks are having with staff as well. So you can definitely look at probably the number of write-ups. They're going to go up. They're going to increase, and just probably the lack of production, right? Like what's going on as far as programming and what's being done. It definitely goes down, and I think that just contributes to people. You just don't really have the energy or the mindset or the focus to be trying to be a part of a program or do some really productive. So I think it definitely contributes to that, and I think if we find ways to just give people some fresh air, some cool water, because I think that's important. We were talking about water, right? It's not just water, but some cool water, right? Just something to cool down with. We can really see those numbers probably decrease, and it's people aren't really making the connections, I think, as far as like staff, but it's, if you live it, you know that's what contributes to a lot of those issues and a lot of those conflicts.
And I appreciated that, you get at that fundamental myth of prison, that, the idea that folks are supposed to use this time for rehabilitation and for emerging ready to be a productive citizen. And when you are dealing with unmanaged health issues, when you're dealing with unmanageable heat, when you're dealing with stressful environments that are eating away at your mental health, the idea that that's going to be a productive environment for folks to participate in rehabilitative programming just isn't realistic. Anybody else, Bob or Janet, did you want to jump in with anything else related to safety?
I would just echo exactly what Michael was saying. Like, anybody that's lived it, when the heat's up, that's when the violent stuff happens. That's when all the so our office dog here is wanting to go out. So that's when the violence goes up, and that's when something's going to happen. You can just feel it, and and it doesn't get any better. You know, it's there, and everybody's waiting for it. Everybody feels it. So
I'd just say that outside of the perspective from the inmates is also the guards. The guards are in this heat too in Texas, and I've heard that there have been a couple that have passed out during those times. So that could be the safety issue when that happens. I know that when we were talking, when I told you about Hurricane Beryl and the inmates were all sleeping on concrete, just going by and doing count because they're not where they're supposed to be. They could be missing somebody, and then they could be in the wrong place, and the wrong place, wrong time could be a safety issue also.
Absolutely. Thank you for that, Janet. And now I'd love to switch gears and talk a little bit about solutions. There are a lot of problems related to climate change that we do not have solutions for, but this isn't one of them. This is an issue that there are some really straightforward, common sense things that we can do to alleviate these issues for folks who are incarcerated, folks who work in prisons, and for their families. Michael, I'd love to turn to you first. What do you want to see happen? What is Remerge advocating for?
We would just love to see at a basic level, you know, up-to-date ventilating systems that are regularly maintained and function or operate depending on the temperature, right? My experience, and I'm sure there's many others, sometimes like in the winter, you know, the cold air is on, and then in the summer, strangely, the heat is on, right? So just a ventilating system that is functioning and operating properly, and like I said, regularly maintained. In addition to that, some people who can afford it, you know, they have fans, but others who can't afford it, they don't have fans. They don't have means to cool themselves down in their cells. We don't. Most prisons that I'm familiar with don't have windows where the inmates can just open the windows up. So I think providing a fan, I think that should be part of the state issued item, and just means for people to be able to cool down. Having access to cool water, I think that's very important, and I think that's a simple solution. You know, ice machines and the pods or the units could be a simple solution. Just these are some things that can be done, I think, fairly, you know, within a reasonable amount of time, and can really kind of help to people with the health issues that the heat is creating. So
thank you for that. And important to remember, just because air conditioning or heat may be present in the facility doesn't mean that it's working, and doesn't mean that it's keeping folks to a reasonable temperature. Bob, looks like you want to jump in on that.
yeah, absolutely. I live the last unit I was in was a 250-man 3-tier, like one of the giant, these big units here in Colorado, and they had this one little swamp cooler that you would put on, like, literally the size of that you would put on a regular house, and they thought that was going to be enough to take care of the entire. You know, it was just like having it was just loud noise more than anything. It didn't really do anything. So I cracked up about that. But I think one of the things I would like to see is more transparency with the. I mean, we're here in Colorado, so the CDOC. I'm assuming across the country, everybody would want the same thing. Like they take temperatures like every day. They 5-6 times a day, you see the guards with the little laser gun thing checking the temperature. I have no idea whatever happens to that data. And quite frankly, that I asked the cops when I was in there, I said, hey, what do you do with that? And they're like, I don't know, you know, so it's there. And just to have somebody like to be transparent about it, to like track that data and say, hey, here's how hot it is in there, and just admit that it's an issue, you know, or here's how cold it is in the winter, that there's, you know, you're chipping ice off the windows on the inside of your window, just because it's getting that cold. But they're just not. And I would love for that for just everybody to be on the same page of like, okay, it's an issue. Like, how do we address it now? But you can't even get a CDOC, anybody to admit it's even an issue. you know, they're like, nope, everybody's great, that kind of thing. So.
Thanks for that, Bob. So having access to data that's already available in addition to new data, and then the reminder that it's not just extreme heat, that's the issue, that extreme cold can be as much of a problem in some of the same places that are also struggling with extreme heat at other times of the year. Yeah. And I wonder for the folks who are joining us today, you know, how many of us do have a sense of what these issues look like in the prisons in our communities. And I've also seen a few folks in the Q&A ask about jails as well. And while there are more policies related to temperature regulation in jails around the country than there are in prisons, I'm sure the same issues around broken HVAC and lack of access to materials that technically on paper are supposed to exist are part of the issue in jails around the country as well. And Janet,
And Megan, I think,
oh yes,
oh,
go ahead.
sorry.
No, go ahead, Michael.
Sorry.
Yep.
Yeah, I was just gonna say, I think, you know, just having not just medical staff, but also like, you know, regular staff, COs, administrative staff be trained and how to respond to heat waves. You know, as Janet mentioned about if you have like a certain medical condition, you know, it might not be good for you to have electrolytes and things like that with diabetes. So just being properly trained how to respond to you know, heat outbreaks and things like that. And definitely, you know, every situation, every person is not the same. And so you don't want to cause more harm if you haven't been properly trained. So I think that's important as well, something that can be implemented you know, fairly soon. So just wanted to throw that in.
Yeah, great point. And there's been other conversation in the Q&A too about other vulnerable populations, pregnant women and other groups that that do require specialty healthcare and where heat can be exacerbating the health issues they're facing as well. And Janet, did you want to share your thoughts? Yeah.
I'm just going to say your question is common sense. And so our common sense is what we're all advocating for here, which is just climate control. With TPCA, it's 85 to stay alive. So we're just asking for them to put in place the ability to control the climate between 65 and 85 degrees. It just seems so simple. And apparently it's not as simple as you think it is.
Well, and I think one of the reasons it's not as simple gets to one of the questions from the chat box of it. Since we have a couple minutes, I would love to ask you all of what do you do when in your community there's a strong belief in law and order and that prisoners are getting what they deserve with these extreme temperatures? How do we respond to that?
I want to respond to that because I tell people when people ask me why this isn't more of a issue, why people don't know this, it's because I was one of those people. I was one of those people that said, if you do the crime, you do the time. But the time that they're doing is unimaginable. And what needs to be done is people need to understand that, you know, something I've said before, my husband was sentenced to prison. He wasn't sentenced to death, which is what you're doing to these people. So the word has to be gotten out. I know that TPCA tries to do that with their mock cell events and just give challenges to people to sit inside that cell for just 7 minutes. They need to know, as Bob was talking about the temperatures in Texas, they've tagged a cell at over 120 degrees. You know, if you talk to these people who, you know, advocate, I'm from a military family, about people that are in the military and what they do to mitigate heat when you're overseas at 120 degrees temperature, the things that they do for that. You know, if you just put that information out there and maybe you start changing people like me.
Thank you, Janet. And I see Denise Rock from Florida Cares, who's on our next panel, has her hand up. Denise, do you want to jump in on this question?
Yeah, I did. I want me to undo my video, but I just wanted to say I couldn't agree with Janet more. One of the things that we have found, well, thank you, there I am. One of the things that we've found to be very helpful is the creation of a mock cell and bringing it around, especially to our younger generation, and to our legislators, but mostly to our younger generation, because they're floored that we would let people live like this, and asking them the question, So your father, your grandfather, your brother does this horrible thing, but is this okay for them to have to live in that? And we've been met with really positive responses from the youth, actually shocked that not only would we allow the heat to crawl up like that, but that we would expect people to live in such small quarters. And and so I definitely encourage that more and more, in society, almost shaming our legislators, for having them live in these conditions and kicking the can down the road every year.
And also
you, Denise.
reminding them, I'm sorry, Ms. Devon, reminding them that it's not just your father, your brother, and your grandfather, it's your mother and your sister, aunt. And when they, when that's put into play, a lot of times it changes minds too.
Absolutely.
I see Amit jumping in as well.
Yeah, I just want to piggyback on what's been said. Denise and I were in the same meeting when Kevin Ring, when we talked about the idea of having that mock cell, and I think we're the only two in the state that actually allow the heat to impact that. Ours is a 6x9 cell. For example, we were at St. Edward's College a few weeks ago. We had over 107 students in there. I found that getting to the students, much like what Denise has mentioned, has been incredibly impactful. However, our overall umbrella strategy is to get to the members of the public, because oftentimes impacted individuals are scared of retaliation, speaking out, and it's just going to impact the family members even more. I literally have family members who have been driven off the road, had death threats because of the nature of their loved one's offense. So that's been the issue in these southern states, especially where we don't only have heat, we have humidity, and we have that climate of being very, very punitive. It is definitely an uphill battle of educating legislators and exposing these conditions to the public, doing things like we're doing right now, where we're giving voice to those, not just giving voice, but also amplifying the voices of those who are system impacted. Social media is another thing that I found to be very impactful. Letters, getting the verbiage out into the general public, by at the same time protecting the individuals who are impacted. So it is definitely harder. I would say it's definitely more of a challenge, but once you tap into that empathetic, compassionate response, I think that is really where we can bring about a change and eventually a complete societal paradigm shift.
Thanks, Amit. And that is a good transition to our policy conversation, but I also want to invite Bob and Michael, any last words that you want to share on this particular issue?
Just to echo Amit and Janet both. No one knows the system until you get involved with it, like a loved one, yourself, anything. And unfortunately, too many people don't know. I didn't know. I had no idea. I was so naive. I'd never been in trouble before. And then you go in and then you realize all this exists. But yeah, no one knows unless you get involved or someone gets involved in the system. So that's just echoing what they're saying.
Yes, and just to kind of, close out on what everybody else was talking about, as far as the mindset of, punishment, I used to struggle with this a lot over those 25 years because you had some, officers that might have seemed like their mindset was that their job and their role was to punish, but, the sentence is the punishment, and during the time that is your punishment. But also, it's supposed to be about rehabilitation. And I think at the core, like as foundation, it's just humane treatment, right? How are we treating these peoples, and what kind of conditions are they living in? Is it humane? And I think if that's the question, and I think the punishment is the sentence, and then let's look at how we're treating people and the conditions that they're living in.
Thank you for that, Michael. And as I always like to go back to, if we're really concerned about public safety and we're thinking about what is going to make our communities safer, that the conditions in prisons are not making the folks who are there safer, and they're not making our communities more broadly safer. And the things that you've talked about, just meeting basic human needs of providing cool, clean water, of giving people a way to be able to make their air cool, of being able to deal with health issues are also questions of humanity and safety that we all have the ability to make a difference in. And we will be having another conversation, a follow-up to this session that really is going to be focused on policy options. So for those of you who are in the chat box asking more questions about next step with policy, we will have another event where we'll be able to get into that in more depth. But now I'd like to thank you, Michael and Bob and Janet, for sharing your experiences and wishing you luck with your continued advocacy. And would like to invite our next folks to join us. So Denise, please feel free to stay and would like to invite David Fauti, who's the director of the ACLU National Prison Project, and Christine Mitchell, who's the program director at the Health Instead of Punishment program at Human Impact Partners, and also an organizer with the Deeper Than Water Coalition. And would also like to invite Amit back to talk a little bit more about what this issue looks like from an advocacy perspective. And our last panel brought up the fact that this is basic human rights. And so, David, I would love to turn it to you to be able to kick us off to hear more about why is this a human rights issue, and why should folks who are concerned about human rights be paying attention to extreme heat conditions in prison?
It's a human rights issue because it poses a risk of injury or death to incarcerated people. And even if it doesn't cause death or lasting injury, it causes pain and suffering that no one suggests serves any kind of legitimate purpose. And the fight against extreme heat is part and parcel of the decades-long struggle for prison conditions that meet minimal standards of health and safety and human dignity. And we've heard a lot about how the effects of extreme heat are magnified and compounded by other problems, other conditions problems, like the lack of adequate medical and mental health care, the lack of adequate drinking water, the absence of effective staff training, and so on. And it's important to realize that this problem is getting worse. It's getting worse for sort of the obvious reason, which we've heard, that the climate is changing and we're having more frequent periods of sustained extreme heat in more parts of the country. But the other reason it's getting worse is because of the changing characteristics of the incarcerated population, because of the brutally long sentences we have in this country, with 1 out of every 7 prisoners serving a life sentence. The prison population is aging. And we know that chronic medical conditions make people more vulnerable to heat, and older people are more likely to have one or more of those chronic medical conditions. Older people are also more likely to be taking medication that makes them more vulnerable to heat. So rising temperatures and an aging prisoner population are going to be an increasingly lethal combination in the months and years that to come. And there's a growing consensus among health professionals that this is just not a tolerable situation. Just a few weeks ago, the National Commission on Correctional Health Care, which is the leading national organization on health care for incarcerated people, issued a position statement on climate control for extreme temperatures in corrections. And it's intended to cover both extreme heat and extreme cold. And it's very short. This is what it says. Extreme indoor and outdoor temperatures adversely affect the health of people residing and working in carceral settings. Every carceral facility should implement standards to minimize extreme temperature exposure indoors and outdoors, and adopt steps for prevention and mitigation. Now, the good news is that there is legal protection against extreme heat, and there are legal remedies. The 8th Amendment to the US Constitution prohibits cruel and unusual punishment. And that includes not only punishments that are formally imposed by a judge, but also conditions of confinement that impose a substantial risk of serious harm or cause the gratuitous infliction of pain and suffering. And it's absolutely uncontroversial. It's well established that at some point, extreme heat in prison or jail violates the Eighth Amendment. And we at the ACLU National Prison Project have been bringing legal challenges to extreme heat and in prisons and jails for years. And we've brought these challenges, and they have been successful in a number of states, including, by the way, Wisconsin, which I think illustrates the point that's already been made, that this is not just a problem that's limited to what we think of as the hot states or the southern states. There's other litigation against heat ongoing right now in the Texas prisons, in the Florida prisons. And one of the things about litigation is that win or lose, it also serves a transparency function, so that when we bring one of these cases, we can force the prison to turn over those temperature readings. We can go in there with our own expert to take temperature and humidity readings to make sure they're not cooking the books. So litigation has a lot of disadvantages. It's often not the best way of solving complex problems, but sometimes it's all we got. And we at the National Prison Project stand ready to continue bringing these cases when necessary to prevent suffering and save lives.
Thank you, David, and appreciate that context, that this is just one of many questions related to the human rights and the humanity of people who are incarcerated and the ongoing fight to be able to achieve those bare minimum standards. And would like to turn to Christine now, and as David mentioned, that there is definitely a health and public health component to this, and would like to hear more from you about how you see this as an issue for people who care about public health and people who care about environmental justice.
Yeah, thank you, Megan. Yeah, I think that both Dave and David covered well kind of the state of the literature on the way the health impacts of extreme temperatures inside, and the context of how that is worsening both on a climate change level and also on a aging prison population level. So I just want to kind of reiterate and maybe further the point that this is a national problem, right? That and so uplifting the Ella Baker Center, who wrote a report called Hidden Hazards on the impact of climate change on people who are incarcerated in California prisons. And then I'm in Massachusetts, and with the Deeper Than Water Coalition, we've done some organizing around extreme temperatures in the prisons in Massachusetts. After hearing about folks passing out from heat stroke in the prisons here, the infirmary being full of people, and then here the Department of Corrections posted flyers all over the prisons telling people to stay hydrated. Meanwhile, the water inside had high levels of manganese and was toxic, telling people to use fans. Meanwhile, fans were not provided and cost money that a lot of people don't have. So there were a lot of kind of like messaging that was happening inside that didn't really map onto the reality that people were living. And here in Massachusetts, it's a public health issue because the Department of Public Health are the ones who are responsible for conditions of health and safety inside the state prisons. So through public pressure, we managed to get the Department of Public Health to do inspections in some of the prisons here in Massachusetts. They found poor ventilation, they found high temperatures across multiple prisons. They found, issues with the water across multiple prisons. And there are lawsuits here too in Massachusetts, right? There was one lawsuit a few years ago that the temperature inside went up to 120 degrees. Meanwhile, the kind of state regulations in Massachusetts are that there are kind of like heating regulations for the winter, where temperatures can't go below 64 and can't go above 78 in the winter. Meanwhile, there are no regulations for the summer. And so, kind of the public health action that people in public health can take in states where the Department of Public Health is responsible for that is to change their regulations, right? Like that is ultimately what's needed at a very basic level. And then to talk about kind of the like legislative piece connected to public health, want to share with folks that Ed Markey and Ayanna Presley wrote a Declaration of Environmental Rights for incarcerated people. They did this in conversation with people who are incarcerated in Massachusetts and nationally. And that includes things like extreme temperatures, but also things like ventilation and mold and toxic water. So Deeper Than Water supported this declaration. As an abolitionist org, we don't believe that prisons can really ever protect people's health and safety, and that decarceration is really what's needed. And this declaration includes decarceration as a strategy to protect people's health and safety inside. And then from that declaration, which was released earlier this year, Markey and Presley also introduced a bill called the Environmental Health in Prisons Act to do that, to protect people's health and safety at a federal level. So folks should stay tuned to see how that moves through the legislature too.
Thank you, Christine. And we do have a few questions in the chat box related to state versus federal policy. And it is a combination. You know, we have a need for action at the state level and then also opportunities at the federal level, both in the courts as well as legislatively, to be able to address this issue. And that is one of the hopes of 85 to Stay Alive is to be building this national coalition around heat and other environmental justice issues. So thank you for that. And in our last few minutes, would like to turn to Denise before I ask Amit to close us out. And Denise, as you're doing this work in Florida, how is everything that you've been hearing resonate with you, and why are you seeing this as an issue that does need national attention?
Well, the air conditioning is a national issue for all states. While it might be hotter in Texas and Florida, it is something that, you know, would preserve humane conditions for everybody. We work on the legislative component, which in all honesty, legislators are the ones that are kicking the can down the road. Our Department of Corrections has said that they would like to air condition their prisons, and they've said that publicly, but our legislators are the ones that aren't able to get there. For us, maybe slightly different than what Christine was talking about, we have used the fact that they don't have air conditioning to get them certain things. Like last year and this year, we just put a lot of pressure on them through social media, Twitter, and legislators to provide ice and 3 times a day on each shift change to fill that 5-gallon jug of ice in each dorm. They spent $500,000 on ice jugs. So we were super excited about that. They also provided electrolyte packets, not Gatorade ones, you know, the off-brand ones, but they would provide 2 with every meal. And then this year we went for even more, and we have been advocating. Someone had said something about the fans, like personal fans. For us, I don't know why they will not do it because they don't want batteries in there, which is ridiculous. But we pushed for just more fans in general then, and our Department of Corrections spent $1 million on fans and put them in a number of dorms across the state. And we were really happy to see that. And last year I had started talking about in places where there's high prisoner population, like where they're waiting in lines outside of medical, outside of chow, that they should have a spritzer. Well, they're working on that for next year. So I can't believe I'm saying this, but I feel like the department has been helpful in those ways, but it's only because we've put sustained pressure on them. And perhaps the biggest thing that they did this year for us was we had said, all right, you got people in 2-man cells, but their custody status is low enough where they can go in an open bay, but they're in a 2-man cell because of your prison dynamics. Open their cell at night because they don't have to have that door closed. And they did it. It was amazing. So we have learned to ask for stuff and be resourceful, and because they do want it. They feel that somebody on here was saying, you know, people that are cooler or calmer, and they have such low staff that they need calmer people. So they're going for it. Now, that doesn't get us air conditioning, but it's definitely gotten us a lot that we were never expecting. Oh, the other thing that we got is normally they have to be in their undershirt, overshirt, pants, socks, and boots while they're in their dorms, even if they're not working. And we got them to release a hold on that as well. They could be in shorts and a t-shirt and slides within their dorms. We were pushing to get them to be able to go to the chow hall like that, and we didn't get that. So I do want to stress, we've never gotten everything we've asked for, but when you ask for the world and they give you something, I feel like we're making progress in some way with them. So for us, there is hope, and we're trying to think of what are those things next year. Next year, we're going to go crazy on these spritzers outside of medical. So that's the plan.
Thank you for sharing that, Denise, and for the importance of that advocacy of being able to just continuously keep trying to move things ahead and keep taking steps. And I also want to thank Christine for that message of, at the end of the day, folks are also safer and healthier if they're at home. And where do we need to be keeping people out of prison in order to move towards health and safety as well. And the combination of those efforts will all be important as we move forward. And would like to thank you all. And we are a minute over time, but want to make sure that we give Dr. Dominic a couple of minutes to wrap us up and share what next steps are for folks who are interested in being involved in 85 to Stay Alive.
Okay, thanks for that. I'm glad I'm a fast talker. Denise, I'm really saddened to hear you guys haven't gotten the fans yet. We talked about this years ago, and I was hoping that they were actually doing that. But one of the reasons why I wanted to move this to a national platform is because what I'm hearing from people from different states is we all have these different mitigating factors, right? I'm here to say that in Texas, we've used them. They don't work. Anything, the body tends to deteriorate over 85 degrees. When we have extreme temperatures, the fans don't work. It's just circulating hot air. The ice machines don't work. It's a burden on staff. And we've been doing research. We worked with Dr. Purdom over at A&M to put in surveys to incarcerated individuals to ask them about those mitigating factors. And what I am hearing over and over and over again is simply we need to put air conditioning in all of these units, and that is what is going to save lives. And we need to have heat indexes below 85 degrees. So to accomplish that, we've been doing essentially the same things that Denise had mentioned that they're doing over there in Florida. We've got all the same things, except we've got them in spades because out of all the states, we have the largest carceral population. So working with legislators, working on litigation, I'm just going to quickly highlight that we are still waiting for the decision from Judge Pittman from the Fifth Circuit preliminary hearings that were conducted. I can tell you that coming up against this difficult political climate, it takes a huge push to get anywhere. We are slowly getting air conditioning in some of the units, a few what they call cool beds here and there, but not enough and not throughout the entire system. And of course, that's what we're asking for. And I believe that is the push moving forward, along with some of the things that Christine mentioned about having that federal standard, because that Eighth Amendment is really great. Oftentimes it's open to interpretation. So we've done some of the things like that Janet had mentioned earlier. We have the heated mock cell. We're amplifying the voices. We're working with legislators. We are following suit with FAM's Visit a Prison Challenge. All of those factors are what's coming in. We've been utilizing to make the little bit of progress that we've made. So the overall call out here is, I believe what needs to happen is we all need to get on the same page where we're sharing the same research and then templating some of the things that are working in our various states, and then calling for federal standards. And I know that I saw the question about Project 2025. We know we're in difficult times right now. But I think that we all know that that's essentially what we have to do to bring about change. And since I only have a minute left, I don't know if I want to answer a quick question or so, or I thought I would just summarize it in a nutshell real quick.
Yes, thank you so much for that. And I can see from all the activity in the chat box that there's definitely interest in more conversation. So I'm very glad that we're going to be hosting a follow-up event to really dive into policy more deeply. But in the meantime, we will follow up with everyone after this event and be able to share back these resources. And please visit the 85 to Stay Alive website if you're interested in signing up for more resources, and also the other wonderful organizations that our panelists represent that are part of the coalition doing this great work. And I'd like to thank you all so much for your time today and look forward to continuing this work together. Take care, everyone.
Thank you, Megan.
Thank you.